Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hi, Jess.
All right. Well, today we are going to talk about how to pick a pediatrician. The clock is ticking, so let's get to it. So, Dina, I remember I was pregnant with my son and I had no idea. People were coming up to me saying, have you interviewed pediatricians yet? I did not realize this was a thing. I thought you just kind of defaulted to the pediatrician that was closest to your house. So let's talk about it, Dina. First of all, when should we start looking for a pediatrician?
Well, it's a thing. So after you deliver your baby, many hospitals require you to have a pediatrician lined up for your baby's first visit before you leave the hospital. So it's important to know who your baby's doctor is well before you deliver. So we often suggest starting the search around 3 months before you deliver, just in case you deliver early. And many pediatricians' offices, like you're saying, will allow you to go and interview us as a potential new pediatrician. So you want to see the office space, and most importantly, you want to ensure it's the right fit for your family, and it's of course all free of charge.
So how do we determine fit? How do we ultimately pick a doctor for our brand new baby?
Great question. So first, the nuts and bolts of it. So you want to make sure the doctor is covered by insurance, because visits can get expensive and you're visiting us a lot in the beginning. We're going to be best friends. You want to also pick an office that's close to you, since you'll be going there often, and you don't want to be traveling far with a newborn. They require a lot of things when you're first starting out. So you don't want to be, most people want to be in walking distance of their pediatrician. You can also ask your OB for referrals. You can get referrals from friends and family members, local moms groups, of course, online reviews. But of course, sometimes take those with a grain of salt.
Oh, yeah. Those local mom groups, boy.
Love them. I love them.
Love them, hate them.
Don't want my name to be on them, though.
All right. Well, what are some important questions to consider or to ask of the, potential office?
Yeah. So basic general questions first is, want to know what type of practice is it? Is it a group practice or a sole practitioner? So you're always seeing the same person or different people. Some people just want to see me. Other people want to switch between people. I personally love seeing the same person from when they're a newborn until I'm sending them off to college, because I like to get to know the family well. Other parents, want to switch between people, which is totally fine. It's really up to the parent. You also want to know how many years of experience do they have, and does he or she have children of their own, which my young self would be very mad at my old self for saying this, but I really do think it makes a difference. I knew all the answers on the exams, but you really don't know until you have your own child and you're up, at 2 a.m. with them screaming and crying with colic. It's a different experience when you have kids on your own. The other big thing is, or it's just doctors in the office, or is it a mix of NPs, PAs, and doctors, which is important to some people. Also important is, are they affiliated with the hospital? Are they academic? And do they go to the hospital to see your newborn after delivery? Or if your child is admitted, God forbid, to the hospital, are they there with your child? Or do they not have admitting privileges anywhere?
All right. What about how do you get your questions answered? I would imagine that's an important consideration.
Correct. Yes. So if you're a new parent, there's going to be a lot of new questions. And I love new parent questions, honestly. So how do you get them answered? So during the day, is it by email, a phone, or a portal? If you call and leave a message, when will you get a call back? Is it going to be a week from now, or is it going to be an hour from now, or it's by the end of the day? Most of the time it's by the end of the day. And who's answering it? Is it a nurse practitioner, or answering service? Will it be your own doctor? And what if it's an emergency or after hours? How do you get in touch with your doctor? Are they open on the weekends? Is there someone always available in case of an emergency? Or do you have to go to the ER, all the time, which is, not ideal. Which also brings me back to the, the hours, which is an important question. So how late is your doctor open until? Do they have weekend hours? Are they have long hours? Are they open from 8 a.m. to 8 p.m. or just from 10 a.m. to 4 p.m.? Because, a lot of people work and they need those longer hours. And also kids get sick on the weekends. If your doctor's not open on the weekends, I would, question that, because a lot of times you need to come in on the weekends, urgently. And it's important, at least for me, in my opinion, to have a doctor that's open on the weekends.
And also whether they do virtual visits, right? Or can you send pictures or things like that?
Yes, because we have a lot of patients, especially during COVID, that were away in different states, and we could easily do virtual visits to them, or they could send us a picture of whatever rash and we can diagnose them over the phone.
Other things you may want to consider is whether the pediatrician is a good fit for your beliefs on parenting topics. topics such as breastfeeding and formula feeding, vaccines, antibiotic use? Are they academic, and do they seem up to date on the latest guidelines and evidence? Do they offer other services like lactation support, parenting classes, CPR? And most importantly, do you feel a connection with them? Because that's important. You need to feel comfortable talking with and being honest with your pediatrician.
Yeah, that's one of the most important things I recommend. In my office, like everything is sacred. Nothing goes out of the office. And I need to, I want you to be honest with me. I don't want to hear the right answer. I want to hear the answer that's, that you're feeling. And I want you to feel comfortable with me. And that's the only way we can develop a relationship. Your child's my child, and I want the best for your child too. So you're my responsibility.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.